Hello, everyone. My name is Dr. Thomas Sims. I'm a dentist here in Scottsdale, Arizona. I also have became a center, what we would call the TMJ and sleep therapy centers. So, in getting involved in that in today's presentation, I want to share a few pictures of what it would look like for those that are mouth breathing, and maybe some of the consequences of that. Now, my intent is not to describe exactly those consequences in depth, but just simply to share with you what it might look like you might find with your children, and frankly, some perhaps with your family members. So, what happens if our children don't breathe through their nose? They can develop headaches, any craniofacial pain type problems. Sinus congestion can occur. As you might find in your children, that tonsils and adenoids can get enlarged. Activation of clenching muscles at night. This is where you tend to clench your teeth so hard you can damage your teeth as well as your jaw joints. And that term is that we use in dentistry and medicine is called Bruxism. Possible airway collapse at night. I spoke of that a moment ago about that site number 4, where sometimes that have a complete collapse where you would develop something called sleep apnea. Poor posture is a very common symptom we see that those are mouth breathing with persons with a forward head position. In our business, we call that posture avoidance. And of course, Johns Hopkins University has talked about how those individuals, especially children, as they're developing, if they have something called sleep apnea, then they can actually have a loss of IQ points. And as I mentioned before, we can actually develop crooked teeth because of mouth breathing. So here's a collage of pictures of individuals or little children that have some sort of breathing issues, from posture problems to just simply want to take a nap anywhere they might be, and behavioral issues. So here's a list of symptoms. At this point, I wanted to show you by way of a pictorial diagram of what it looks like to have these symptoms, and perhaps another time we can speak a little bit more specifically what the consequence of having these symptoms would be. So the first one is mouth breathing. One thing you can find on this is that our children, when you walk into their bedrooms at night, you can actually evaluate their and observe whether or not they have their mouths open. And if they do, that is a very highly suggestive that they're probably mouth breathing in the day as well. Poor sleep, because of the poor sleep that our children receive, because they're mouth breathing, they tend to toss and turn. If they have fragmented sleep, or possibly if they have apnea, they could wake themselves up to a certain degree. But in the end is that they have poor sleep, and they show the effects of that during the day. Chapped lips is another common symptom we see. Because the air is rushing through the mouth in and out, it tends to dry the lips out and developing that chapped lips. Inflamed gingiva. Gingiva is referred to in dentistry as the gums. So gingivitis, itis meaning inflammation, so gum inflammation. Gingivitis is very common for those that are mouth breather. So you can see that right around the necks of the teeth, and what happens is the teeth or the air dries out the gums to the point that they become inflamed, and hence we develop something called gingivitis. Venous pooling is another common example of symptoms we might see both in children and adults, where as a symptom of those having poor sleep at night. So forward head posture is another problem that I spoke of that earlier, about a forward head position or that posture avoidance. This can create a lot of havoc within our skeletal frame, pain and discomfort, back pain, shoulder pain, that type of thing, neck pain. So here's some examples of individuals we've treated over the years. This young lady on the left is a before and after is a 15-year-old, and the one on the right is a late 20-year-old. But you can see the uprighting that they're developing, and you imagine the one on the far right, her after picture, she has less back pain, less back discomfort because she's uprighting her skeletal frame. So the head, neck, and head pain. This is a kind of a curious thing, because as I have sat with children in front of their parents, and especially moms, I'll ask the child, "Have you ever had a neck or a headache?" And of course, the child will usually ask me, "What does that mean?" And I'll describe to them what a headache is. And as I do so, the child sometimes will respond, yeah, I get those all the time. And of course, mom sitting to the side of the child is now realizing her child has headaches all the time. And she looks over at the child and says, how come you didn't tell me that? And of course, the child looks back at the mom and says, well, you don't get headaches too every day. And the conclusion is that children, when they develop these problems, they don't realize that it's not normal. And so when they go about their activities, they think what they have, a headache or whatever, they think it's a normal thing. And so they think mom has them as well. And so unfortunately, it is not. Enlarged tonsils and adenoids is another common problem that we see. And we can get into that at another time. But tonsil and adenoids are very common to see swollen at those that are mouth breathing. Anterior open bite, this is where the back teeth are touching in the very back as they close down, and then the front teeth are open, as you see. And the reason this occurs is because the tongue is creating that opening by pushing outward on it. And just a quick understanding is the person is trying to breathe, trying to get the tongue out of the way so they can breathe. Orthodontists hate anterior open bites. They can certainly close them down with braces, but the problem is, and the one thing they hate, is that it comes back. And so that's because the airway issue is still there. Nocturnal Enuresis, this is wetting the bed at night. And of course, children that have prolonged problems with this, if that ever happens, one should certainly evaluate the sleep and making sure that things are adequate and that is not a problem when they're sleeping at night. Tongue-tied, or the frenulum, which is referred to attaching itself to that lower jaw. Sometimes you can have these attachments elsewhere in the cheeks and also in the upper lip. But the problem primarily with the lower tongue-tiedness is that they, as is indicated here, that it's have a difficulty of breastfeeding because the tongue can't get up to the palate. But because the tongue can't get up to the palate, the upper jaw is not developed as it should be, and can result in some other problems as that child develops later in life and not growing that upper jaw as it should. Bruxism is another common problem we see with children, and frankly in adults as well. Bruxism can be very damaging. It can obviously damage the teeth as you clench. It's clenching and grinding of the teeth at night. And it can cause one to damage the teeth to the point that they have to have restorations placed, and also can damage the jaw to the point that can be cause craniofacial pain type problems. Another thing is ringing of the ears. Ringing of the ears is something that occurs when this clenching that occurs, this bruxism occurs, and has that damage as that damage occurs to the TMJ area, can also damage the area, causing the point of having tinnitus or ringing of the ears. Another symptom is crooked teeth. The upper jaw develops according to where the tongue pushes the teeth. So if a person is mouth breathing, the tongue isn't doing what it needs to do at a very early age in developing the upper and lower jaws to receive or have those teeth erupt into them so that they're in proper positions. When one is mouth breathing, once again, you can see vertical development, excess vertical development. So craniofacial changes can occur. As you see on the far right skull, that the jaw is further down. That's the whole head from the tip of the forehead to the tip of the jaw, or the chin. You can see that jaw has, or the whole head is actually longer than normal. You see this in this young man here is a mouth breather on the left and the one on the right. We can see that their jaw is just simply retrognathic, the one on the left, and longer. A couple other pictures of that. We can see these Kelly and Samantha are sisters, and Kelly at age 7, Samantha age 8.5. You can kind of see Kelly has her mouth closed, and Samantha has her mouth opened. Kelly, and this is several years later, you can see the way she looks now, and you can see that she has her lips together, has good lip seal, and everything looks fairly normal craniofacial-wise, where her sister Samantha is having a hard time getting her lower lip, and that mentalis muscle is struggling to get lip seals so that she can try to breathe through her nose. But that's what happens many times with those that mouth breathe. It's a difficult time to actually get good lip seal. Here's another example of a young man that was a nose breather in his early age, and then later he developed into mouth breathing, probably from swelling within the nose of some sort, obstructions of some sort. And as he developed into mouth breathing, you see the craniofacial changes that have occurred. Here's another good example of a young man of early age, and as he developed from from a nasal breather to a mouth breather later down his road. So my presentation about the nose is simply evaluating these things. I would encourage you to evaluate your children, especially in the evening as they breathe and sleep at night, and to see whether or not they are mouth breathers. It is interesting. We dentists, we can actually help with these problems in our centers, and we can help, especially for children, we can help them develop in a normal way, and give the necessary aids and instruction to both the child and the parents to help them develop in the normal way so that they can have proper breathing as they become adults. And the good news, we can also work with adults as well if that is the need. So thanks for listening. Perhaps we get together again and having further discussion on the specific consequences of these symptoms and what the ins and outs of all of them are. Once again, thanks for listening and take care.